Malaria is one of the life-threatening diseases the world is battling with. According to statistics from the World Health Organization, 3.4 billion people live in areas at risk of malaria transmission in 91 countries and territories. Malaria is a disease that is transmitted through the bites of infected female ANOPHELES mosquitoes. In Nigeria, virtually every resident has had to deal with the disease at one time or another. Children under 5 years of age are considered the most vulnerable groups affected by malaria. In terms of statistics, in Africa alone, about 285,000 children died before their 5th birthdays in 2016 alone. Yes, serious cases of malaria attack, when left untreated, can even lead to death of the patient, old or young. Do people know how deadly malaria disease can be? When you have malaria, what is the best approach to dealing with the disease? How can we prevent and treat this pervasive disease? This is our focus on Nigeria today. Welcome and thanks for joining us on this midweek episode of the program. My name is Kande Daniel. And as Nigeria joins the rest of the world to commemorate this year's World Malaria Day today with the theme, Ready to Beat Malaria, I have an expert in the field of beating malaria. She works with the World Health Organization as Malaria Control Manager. Her name is Dr. Linda Ozo. You're welcome to the program.
Oh, thank you very much. Good evening, Nigerians.
Well, I do not quite envy you and I the task to discuss malaria on Nigeria today, because malaria obviously is a disease that's so rampant, so prevalent, that people have begun to take it for granted, and almost everybody considers themselves an expert when it comes to the issue of malaria. So, Dr. Ozo, I'd like to begin by asking you to simply tell us, in the simplest of language, what is malaria? When do I know for sure that I have malaria?
Well, thank you very much. Malaria, in its simple term, is a disease caused by a parasite that is carried by mosquito, specifically the female Anopheles mosquito. And this parasite, in our environment, the prevalent parasite is the P. falciparum, which causes the malaria. And unlike what many people think, I know that day-to-day life, people still, patronize the patent medicine vendors. Whenever they have fever or they are feeling weak or they have symptoms, they feel, in quotes, is malaria. They go to purchase their medicines, but no. Malaria, we try to emphasize and stress the fact that all fevers are not malaria. There are so many other diseases that can cause fever. Malaria, for you to identify or to be diagnosed with malaria, you have to go through a process, through a testing. You have to be tested with either the rapid diagnostic test for malaria.
So now you're telling us what we ought to do when we think we have malaria.
Absolutely.
Go ahead.
Yeah. So you need to be tested. So for any time you think you have malaria, do not go ahead to self-medicate. It's important that you get tested with either rapid diagnostic test kits, which is a very simple technology. It just requires a simple pin prick, needle prick, with the blood, and in 10 minutes, 15 minutes, your results are ready. So it's
how available is that now?
It's very available. I can assure you that in almost all primary healthcare facilities, you would find the rapid diagnostic test. But that's not all. We can also test using microscopy. And you find microscopy in most hospitals, both public and private hospitals. So it's important that for each time you think you have symptoms that mimics malaria, that you get tested before receiving treatment.
Right, so treatment from the doctors only. What do you think about herbal options? A lot of people are doing that these days.
Well, particularly in WHO, one of the health system's building blocks is innovation. We encourage innovation, we encourage new tools in the fight of diseases. In fact, as the current drug recommended for the treatment of malaria is plant-based. It's artemisinin combination treatment, which is plant-based. However, apart from the ACT, there hasn't been any other proven herbal treatment for malaria. So people who go treating with herbal medicines do that at their own peril. While we do not counter the fact that there may be some herbs with anti-malaria effect, it may not be sufficient enough for the treatment of malaria. So we strongly discourage the use of herbal medicines for the treatment of malaria.
I think it's still important at this stage, again because of presumptuousness, that we talk about how to avoid malaria. Is it possible in Africa to live without malaria?
It is very possible, and this is why we are saying let's all join hands to beat malaria, because malaria is totally preventable, is treatable, is curable. There's absolutely no reason why anyone should die from malaria. To prevent malaria is very simple. The tools are available, they're effective, they're proven, they're scientifically proven to be effective. First, we have the long-lasting insecticidal nets, or long-lasting insecticide-treated nets. These nets are available through the national programs. These nets are provided to households free. You know, they are given to households during household campaigns, and so everyone is encouraged to sleep inside a mosquito net. And other options for prevention of malaria, we have what we call the indoor residual spraying. Indoor residual spraying is also a mechanism where skilled technicians go inside the houses and spray the walls of the houses to prevent malaria, but this is only done in targeted areas. For pregnancy, pregnant women can be prevented from getting malaria. So every pregnant woman is encouraged to ensure that she receives what we call intermittent preventive treatment of malaria, IPTP. And this is, the pregnant woman should receive SP, sulfadoxine pyrimethamine, starting from the earliest contact in the second trimester of pregnancy. So 13th week of pregnancy, every woman should receive the SP every month, 1 month apart through the course of pregnancy.
Is that a kind of vaccination?
It's not a vaccination, it's a medicine for prevention of malaria in pregnancy. And then we also have some preventive measures that we use in very targeted areas, like in the areas in the Sahelian belt. We have, in Nigeria, we have 9 states that are within the Sahelian belt. And so because these areas have very seasonal transmission, seasonal meaning while transmission can be perennial, it goes through the year, but they have seasonal peaks because they have very short rainfall period, about maximum 3 to 4 months, and these are the times of the highest malaria transmission. So to beat the effect of malaria during that season, we give what we call seasonal malaria chemoprevention to children under 5. Now, this seasonal malaria chemoprevention involves the administration of medicines, anti-malaria medicines, identified medicines, to children under 5. And it's given, periodically 1 month apart, to make sure that they have drug concentration in their blood to prevent them from getting the parasite, from getting the disease. So there are so many preventive measures. And again, for you and I, what can you do apart from using it, apart from when you have the opportunity of getting your houses sprayed? What else can you do? The little things like the breeding sites. And when we think about breeding sites, the myth is people think about the gutters. No. Mosquitoes, the mosquitoes that carry the parasite actually breed in fresh water. Yes. So breeding in fresh water means that the storage cans, the drums you have in your homes, the storage buckets in your bathrooms, you leave them uncovered. Those are viable breeding sites for malaria, for malaria parasites. So it's important that we take care of those breeding sites to control the breeding of malaria parasites.
Is vaccination strong in the system now for the purpose of both prevention and treatment of malaria?
I won't say it's strong, but late 2015, WHO made a recommendation on a vaccine, RTSS vaccine, which is also called the Mosquirix. This vaccine had gone through trials, and the recommendation was for it to be piloted in a few countries. And the main reason for this pilot is it provides special protection, but more especially they wanted to test the feasibility of its introduction. So it's being piloted in 3 countries, in Ghana, in Malawi, and in Kenya. And we hope that after 2020, the results of the pilot will be available then. It may be available for scale-up to other countries. Currently, it's not in commercial use across countries. It's only been piloted in these other 3 countries.
Speaking with the voice of the World Health Organization now, how would you rate Nigeria? What do the latest reports say? I'm aware that Nigeria is not one of the countries in Africa that has been rated as capable already to eliminate malaria by 2020. That's the projection. Nigeria is not included in that list of 6 African countries. What else does WHO say about Nigeria?
Nigeria currently is in a control program. So the continuum will have countries that are in control phase, we have countries in pre-elimination phase, and we have countries in elimination phase. For now, Nigeria is in control phase. Our prevalence rate for now is 27%, and this was with the latest malaria indicator survey that was conducted in 2015. And given that statistics, we know that what is mostly needed is for us to accelerate actions towards achieving the set targets within the malaria strategic plan. In the malaria strategic plan, which spans from 2014 to 2020, the country articulated strategies that will guide us to getting to the strategic goal. What is the strategic goal? The strategic goal is to reduce the prevalence of malaria in Nigeria to less than 5%, which means we want to get it to a pre-elimination level, where malaria is now, where Nigeria will be counted as those countries approaching elimination. But until we get there, we're still in a control phase. And so for us, the focus is to make sure that we scale up interventions, make sure that every household, every family, every person optimizes and utilizes the preventive strategies that are available. When you feel like you have malaria, everyone gets access to affordable diagnosis and treatment. And for now, that's priority for us. We need to make sure that we optimize the preventive measures and optimize the treatment measures to make sure that we get to the set goals by 2020.
All right, I'll let you take a breath now. When we come back from the break, I want to know more about WHO intervention in Nigeria concerning malaria control, prevention, and treatment. We'll take a break here and go to the streets, where we will get some responses from Nigerians on what they know about this deadly disease called malaria. Stay with us.
Malaria is a common thing that we are actually, facing in Nigeria, and then the causes of they say it causes malaria, and we know that it causes malaria. But as an average Nigeria, some of us take it very lightly. But from what studies have shown, that malaria actually kills faster than HIV if not properly handled.
You know, it's a disease that if you leave it untreated, it can cause a lot of damage. But like me, if I feel the symptoms of the malaria, the first thing is to go at least to hospital for test. Let me check up what is it malaria or something else. But if I find out that it's malaria, then I'll go for the treatment.
Malaria is actually dangerous. The fact that people actually look down on it, don't give it more ignorance. They're ignorant to it. So they find out, they don't actually find out that it's actually dangerous. So they just look down on it. Well, at the end of the day, actually causes bad effects, then killing them. Unknown to them because of the ignorance. So personally, malaria is very, very dangerous.
I take precaution, especially looking at the causative agents, perhaps mosquitoes especially, and so I take care of my environment to ensure that these mosquitoes are not available.
We know malaria is a killing disease, a killer disease, but then we must be able to approach it depending on what is comfortable or agreeable to our own system. You understand? So those are the two approaches I think we can. If it is acceptable to use the scientific means, go ahead, well and good, you can be cured. But it's also acceptable to you to use the orthodox means for which we are trained, we are raised. Go ahead and use it. The important thing is that you are healed and healthy.
Welcome back. You're still onto Nigeria today, and we're talking about curbing the scourge of malaria. And my guest, Dr. Ozo from the World Health Organization, is still here. Dr. Ozo, you heard our respondents out there, and I'm wondering, as an expert, you're listening to them sound like experts. What strikes you most about those responses?
I was excited listening to them. It means that the messages we put out there are actually working. It means that people are listening, and it means that people are ready to take charge of their own health. Because the first point, the first process of taking charge of your health is the knowledge. So when you know, when you know the repercussions, the effects of non-treatment or non-prevention of this disease, then it makes you take better proactive steps or more proactive steps towards either preventing or treating when you do get malaria. So I'm quite excited with the comments.
Right, before we went on break, a little before the break, you were beginning to say something about Nigeria's strategic goals, and how much of it we're achieving. I'd like to know, in particular, is the WHO impressed with the funding by the Nigerian government for the control and treatment of malaria?
The truth is the Nigerian government has done a lot to support the malaria program. They have provided funding, they have provided the enabling environment, they have attracted partnership and donor funding towards the disease. But the truth is that the magnitude of the disease keeps, the gaps remain. And so while the funding has been quite substantial, a lot more needs to be done. And so we haven't gotten to the point where we can relax on our backs to say, oh, we have done a lot. No. The funding is a lot. I commend government for its efforts, but we must be willing to do more.
But Dr. Ozo, if the gaps are remaining after so many years, at least in the last 1 decade, there's been a lot of activity and campaign. What are we not doing right?
Well, like I said, it's not about what we are not doing right. It's about why we are where we are. And I would sincerely say that the national program has taken a strategic approach towards identifying tools, strategies for malaria program. And in aligning with the global program, there were old tools which at some point needed to be changed. I'm sure you knew when malaria was being treated with chloroquines. After some time, chloroquine became ineffective. There was resistance to chloroquine. It took years and years of innovation, of research and development to arrive at new tools to help, you know, identify new tools that are proven to be effective against the disease. So the rollout of these approaches and new technologies, you know, took a bit of time, but we are there. We have scaled up for impact. We are now at the point of, you know, going for universal coverage. And until we get every citizen, every household, everybody who needs care to get adequate care at affordable rates, we cannot beat our backs to say, oh, we have gotten to where we want to get to. So I don't think the program is doing badly, but it behoves on us, myself and you, the community, the government, everyone. It needs to be a collective effort for us to actually win this war against malaria.
Can you take some seconds and explain to us in a way that we can understand, we non-experts can understand, this thing about resistance, drug resistance by the parasite? How does that happen?
Okay.
Because, you know, we have issues of fake drugs, we have issues of adulteration and all of that. But when we're told that the parasite can resist even a good medication, we don't understand it.
Yes. So without causing a lot of confusion, I'll try to explain it in the simplest terms I can. So the drug resistance is a mechanism whereby the parasite, that's the P. falciparum in our case, becomes resistant in a way that even when you treat with quality assured medicine, the individual may not achieve cure using the medicine. So that's the simple explanation for the drug resistance. But the good thing and the good news is, while Nigeria has not gotten to the point where we can say we have drug resistance for the ACTs, we are mindful of the fact that this is a threat. It is a real threat. I'm sure you may have heard of countries that are battling with drug resistance, like Cambodia, countries in the greater Mekong region. So WHO is doing the best it can to make sure that it contains that resistance within those areas such that it doesn't spread to other areas. But while we are doing that, we as a country, we also take time periodically to do what we call the therapeutic drug efficacy studies. This therapeutic drug efficacy study is an assessment or a study of the drugs that we use for treatment of malaria in our environment to make sure that it's still very efficacious, it's still very effective against malaria treatment. The last was done in 2015, and we're planning to have another one this year in 2018. And so till date, the drugs that we're using for the treatment of malaria, the artemisinin combination treatments, are still very effective against malaria.
All right, we're running out of time. It happens often with a good conversation. But I'd like you to end by giving Nigerians hope. Tell us, what are the latest or current interventions of the WHO concerning the malaria scourge in Nigeria?
The WHO, as you know, is responsible for providing tools, identifying tools, providing tools, guiding countries towards strategies, the mechanisms, the approaches for malaria control. And as of now, Nigeria is well aligned with the strategies that have been recommended by WHO. And so we are hopeful, and we know that if we deploy the interventions we have, the strategies we have at the right scale, and people optimize the strategies, people use these interventions, the uptake is high enough, the health-seeking behavior is increased, the healthcare systems are strengthened enough to cater for the need of the people, we are very certain that we will win the war against malaria. Before I end, I'd like to tell you that we had an unprecedented achievement. Between 2010 and 2015, malaria prevalence reduced from 42% to 27%. This is unprecedented. It was a sharp decline, and this was because we were able to scale up the tools, the available tools, to the population in need. So we believe that if we sustain these gains and accelerate further actions to achieving the goal, we will win the war against malaria.
Great. Thank you so much. We're glad you came. Thank you, Dr. Linda Ozo. We'll end the discussion here. Thank you for coming.
Thank you very much. Thanks for having me.
That has been Nigeria Today this Wednesday with Dr. Linda Ozo, who is the Malaria Control Manager, World Health Organization. Well, thank you for watching, and remember, you can watch the program online at www.youtube.com/NTA News 24 Hub. My name is Kande Daniel. See you next time.